Ons gesels vanoggend weer oor jongste nuus rakende die Covid-19 inenting. En Prof Francois, ek gaan net vra dat Prof net herhaal wat vir Prof uitstaan rakende die jongste nuus met betrekking tot die Covid-19 inenting, net opsommend dalk.
So it's hot off the press. Late last night, there was a whole lot of data presented, confirming what we were actually scared about, which is that this new variant has torn its way through the country. Across the country, over 80% of new infections are this new variant. And in Gauteng, we had data last night suggesting it's even over 90%. This new variant is almost certainly more infectious, and the second wave that we've experienced over December and January is 2, maybe even 3 times worse than it was during June, July, during the first wave. So not good news.
Wanneer 'n mens kyk na hierdie berigte wat hier rond te doen en ook gerugte, ek dink mense is oor die algemeen steeds paniek bevange, want daar was in die verlede berig dat ons in die wintertyd 'n derde vlaag kan verwag. So wanneer 'n mens nou kyk na die jongste getalle miskien wat die infeksiesyfer betref, as ook die sterftesyfer, en dan ook die plan rakende die implementering van hierdie inentingsproses. Hoe moontlik is 'n derde vlaag in die winterseisoen?
So several countries are experiencing a third wave, and it's important that people understand that we're just not 100% sure if it's seasonal. So are we going to hit it in the winter, like you said, which is what we see with many other viruses? So it would make sense. We hit June, July was the worst, started in Western Cape and Eastern Cape, spread across to KZN and Gauteng, and then in December, January, the same sort of pattern. And if that was the case, we can anticipate that June, July again, we're going to see the same thing. The problem with that is that there are other countries which have had different patterns. For instance, Portugal's third wave, they had a second wave which looked like ours, and then they had a third wave almost immediately. It was almost on the back, straight away on the back of the second wave, which was actually worse, far, far, far worse than the first or the second wave that they had. And then there are countries like many countries in Europe which have had a second wave that's just gone on and on. South Africa's second wave went up, and it seems to have come down very, very quickly. While in the cases of some of these other countries, their second wave has grumbled along. So, we just don't know. We just have to wait and see. In the context of vaccinations being available, that's going to accelerate our immunity to whatever the phase or the third, fourth, fifth, sixth wave is going to take. If we don't have a vaccine, we're going to need probably 6, 7, 8 waves before we get anything close to protection levels. So it means it's years and years before we get there.
Goed, ons gaan nou verder gesels.
Ja, ons gesels net na jou 7 uur nuus weer in verkeer verder hieroor.
Ons gaan voort met vanoggend se gesprek oor die jongste nuus rakende die Covid-19 inenting en dit met professor Francois Venter. Weer eens dankie dat Prof by ons aansluit vir hierdie interessante gesprek. Soos ons weet, word daar dan nou berig dat die enstof teen maandag hier by ons gaan wees. So ek wil net hê ons moet verwys na die implementering van hierdie plan om dit suksesvol uit te voer en dan ook ons regering se vermoë om dit suksesvol uit te voer.
Yeah, there was a webinar on Wednesday night, which unfortunately didn't fill me with a huge amount of enthusiasm because it was very short and detailed. We are expecting the first 1 million odd doses to be here. Remember that you have to be vaccinated twice, so that only covers 500,000 people. It's not totally clear on the details of how this is going to happen. They've prioritized healthcare workers, which is great, and they're easy to get to because you just go to a clinic or to a hospital or go to a pharmacy and get, you can sort of flash your medical card. Beyond that, the so-called phase 2 of frontline workers, everybody who's really, really high risk in terms of both where they work and in terms of what diseases they got, is going to be the phase 2 phase. And we still haven't got a lot of detail about how that's going to work. It's a mammoth task. People must not underestimate how much work is going to need to be done to coordinate people getting, the whole, essentially 70-80% of the adult population is going to need to be vaccinated for us to get to the so-called herd immunity, so that we're all protected.
Ek wil graag verwys na die berig vroeër in my nuusbulletin, waar ek verwys het na die feit dat South Carolina in Amerika 2 gevalle aangemeld het van die coronavirus variant wat eerste in Suid-Afrika geïdentifiseer is. Dit is nou wel die eerste 2 gevalle hiervan in Amerika En wat dan nou interessant is dat gesondheidsamptenare sê, die 2 volwassenes het nie onlangs na Suid-Afrika gereis nie en ken mekaar ook nie. So ek dink dit skep ook opnuut kommer rakende die nuwe variant, nie waar nie?
No, absolutely. And in fact, 2 people in America without a travel history means it's everywhere in America. It means that, the Carolinas have got the virus everywhere. And this thing is so virulent. It just takes over from the other variants immediately. And people must understand this is not unexpected. This, there's a UK variant, there's a Brazilian variant looking exactly the same in the sense that it's very transmissible. It's much easier to get than the one that we got hit with in the second wave. And we can anticipate there'll be an Indian and an Australian variant. Just as long as we don't have population level immunity, this thing is going to mutate and there's going to be variant after variant after variant. So it's unfortunate it got called the South African variant. It's not even clear it arose in South Africa, but there's going to be every other country is going to have its own variants quite quickly. But the bottom line is for the Americans is it's game over in terms of trying to lock its borders away from us. It's everywhere there.
Sure. Jorna, jy het 'n vraag oor
Ja, ek het ekskuus nog prof, is Jorna, die oortollige sterftes. Dit is my baie interessante konsep want daar is 'n statistiek om te sien hoeveel mense normaalweg in 'n jaar sterf in Suid-Afrika en dit is my 'n praktiese ding om te dink iemand is as jy nou in 'n rural Oos-Kaap of KwaZulu-Natal is, weet jy daar's nie hospitale nie, ons land is ongelooflik wyd. Selfs 'n boer op 'n plaas. Jy dink jy het 'n verkoue gekry en sometimes people really die quickly. Is dit 'n aanduiding dat van COVID, hierdie verskriklike oortollige syfers dat ons eintlik dan meer as 100,000 sterftes al gehad het?
So it's a great example, somebody on the farm dying, and we don't know whether it's COVID, we don't know whether it's somebody who's just scared to come to the health facility, it's somebody who's run out of the insulin for their diabetes. So there are lots of reasons why that person might have died. So what we do is aggregate all that data, and South Africa actually collects that data very well, better than almost any other country in Africa, and probably better than most countries in the world. And what they do then is they compare it to previous years. So how does January, February in 2020 and 2019 and 2010 compared to January 2021. And what we've seen over the last few months is a dramatic increase in people dying. Now, we can't hand on heart say every single one of those are COVID. As I said, some of it might be just people staying at home and being scared to come in. Some of it might be that, they lost their jobs and they haven't been able to afford their treatments. All of those things are there. And that's what we translate into the so-called excess mortality. So they're very clever people who untangle this data and look at it. And what they demonstrated, and this data only came out this week, is that, in fact, what happens normally is that there's a big peak over winter. That's when pneumonia comes, that's when flu comes, it's what kills a huge number of people in this country. And December, January in South Africa was worse than the worst winter we've had. So there's clearly something going on. And these clever people say it's almost most of the what we call the excess mortality is related to COVID. Some of it will be because of, as I said, fear of accessing services, people sitting on a farm and waiting for this thing to go away and dying suddenly. But this virus is extracting a terrible death rates across the country.
Prof Francois, en ek dink ook daar word berig van die emosionele tol van COVID-19 waaksaal en ek dink dit is ook iets om in ag te neem. Maar baie dankie vir die insig wat Prof vanoggend met ons gedeel het.
Absolute pleasure.
Dit was dan Prof Francois Venter van Wits.
Baie duidelik het mense sy vorige onderhoud gekyk en mense is dors daar buite want ons het al 3 WhatsApps gekry wat dadelik gesien het dat die prof nog glad nie aan sy koeldrank geraak het wat agterop koeldrank in aanhalingstekens.
Dis interessant.
So almal vra kan asseblief hom kontak en sê duidelik drink jy nie daai nie. Stuur dit vir ons. Maar ek moet sê die prof lyk vir my weet of hy hard werk. So die manne vat baie houe.
Ja.
Sjoe. Baie dankie vir daai. Bly ingeskakel, ons gemaak 'n draai in die kombuis hierna en dan sit ook lekker musiek vir jou as luisteraar.